Globally, Chevron is known for our health and safety culture, in which it is embedded in our OE tenets of operation. We are guided by two key principles: do it safely or not at all. Second, there is always time to do it right. We adhere to these two key principles in any work environment we are working in, may it be on the offshore rig, in our refineries, in our terminals, and even in our office environment we work at. We never compromise on the health and safety of our employees. I think one unique feature common to most multinational organizations is that we have an organized global health and medical department that is really embedded in the business. In Chevron, we have a general manager who drives and develops corporate health strategies. And we have regional medical directors and country medical managers supporting each business units across the different continents where we operate in ensuring all health resources are in place. We are separate from the HES department that gives us more autonomy to prioritize on health and wellness programs for the entire enterprise. The goal of Chevron Health and Medical Department is to provide health and work-life resources to Chevron employees and organizations around the world to improve productivity, reduce safety risk, and enhance a healthy work environment. Here in the Philippines, my team support the three Chevron operating companies, namely Chevron Holdings, which is one of our corporate regional headquarters, Chevron Philippines, which is our downstream group, which is Caltex, and Chevron Malampaya, which is a non-operated joint venture with Shell and government. And from time to time, my team also provides support to Chevron Shipping, as we have hundreds of Filipino mariners manning our fleet of oil and LNG tankers across the seas. Chevron Health and Medical has several key programs divided into the following categories: Operation Excellence Process, Occupational Health and Primary Care, Health and Productivity, the Medical Suitability for Expatriate Assignment, Emergency Response, Employees Assistance Program, and Work-Life Services. And our dual program, the Ergonomics and Repetitive Stress Injury Prevention Program. For our OE process is FFD, which is Fitness for Duty. It provides a globally standard process to enable employees to safely perform physical, psychological, and cognitive requirements of their job without risk to self, to others, or the environment. FFD has 4 key components, namely pre-placement medical exam, transfer medical, for-cause, and return to work evaluation. We don't use a generic routine medical exam procedure for our FFD, but a tailored fit for duty assessment depending on the type of work the employee does. So the more safety sensitive the work is, the more extensive the workup we do. Aside from providing consistency within the organization, Fitness for Duty provides value by ensuring work fit between the individual employees and their tasks, thus achieving higher performance. Fitness for Duty also reduces costs associated with injuries and re-injuries. Chevron provides primary care on occupational health services every day at the office. The clinic is open 24 hours, 5 days in a week to cater even to our night shift employees. And we usually get at an average 7,000 clinic visits every year. And in every consultation or checkup we do health risk assessment. Having an on-site clinic gives certain advantage. Primarily, HMO premium, we get to get a smaller premium. Primarily, we get to gatekeep and control and manage our own employees. And the employees themselves do not need to take leaves for them to seek medical consult. We also provide evidence-based age risk-specific annual medical exams, not only to the employees but also for their dependents. Also, the clinic provides travel medicine consult to our business travelers, providing travel medicine advice, providing medical emergency kit, and vaccine when it is needed. For our health and productivity programs, we have Healthy Heart, which provides online incentivized educational tools and resources about heart disease and supporting employees to make healthy life choices. Our Healthy Heart program is managed by WebMD, an internationally renowned medical resource company. Also, Chevron offers vaccination services, offering different types of vaccine to our employees to protect staff from illnesses and reduce absenteeism. The Health Trails. The Health Trails Activity Challenge is our opportunity to let employees practice a simple set of healthy behaviors designed to help improve their habits and lead the way to a greater sense of health and well-being. Employees earn miles when they engage in some or all the Health Trails daily program, like walking 10,000 steps a day, drinking 48 ounces of water every day, or get at least 7 to 9 hours of sleep, or just by answering the daily tip question. Points that are earned is given to a charity in forms of monetary donations. And through our sickness absenteeism management program, we provide support to HR and supervisors in dealing with chronic absenteeism. My team uses the Bradford scoring system in determining employees with chronic absenteeism, particularly with focus in helping the employees with their illness before it becomes a real concern. Home visits are done when really needed to ensure the well-being of employees. Our Way to Fitness is another gamified activity with focus on practical nutrition and encouraging simple activities to attain weight loss. Next is the Fruit a Day activity, wherein the company distributes free fruits. We do it quarterly for employees to encourage good nutritional habits. And to encourage physical activity, we brought in Zumba classes and yoga to the workplace. Also, we partnered with Gold's Gym to provide employees access to affordable fitness facilities. Other health programs of health and medical, the Medical Suitability for Expatriate Assignment, or MSEA. This is one of Chevron's unique global health program. This process ensures the health and wellness of expatriate assignees and their dependents from pre-assignment, during assignment, and post-assignment. The company is spending a lot for our international assignment program, and my team ensures that each expat staying in their host countries are well taken care of. And prior to expatriation, our team does the physical and psychological evaluation to the expat and their dependents, also ensuring that medical resources are available in the host country. For emergency response, aside from our internal medical resource, We use ISOS and Helix, both known for their medevac services. Aside from the emergency medical services, we have the Pandemic Emergency Response Plan and Disaster Management Response Plan, which is an integral part of our business continuity plan. And for public health, aside from being a corporate contributor to the Global Fund for the fight against HIV, TB, and malaria, locally, we take part in supporting local public health initiatives like the Red Ribbon Foundation for HIV and the Mental Health Matters for mental health. Chevron is one of the first company globally that provides employees with Employees Assistance Program services. It started out during the 1960s when we provide psychological counseling and alcohol abuse counseling, which later evolved in a much wider scope as EAP, in which we not only provide psychological counseling, but also financial, legal, family counseling, as well as parenting, resiliency, and self-improvement sessions. We at Chevron value work-life balance. That's why we have flexible work schedule and work from home offered to our employees. And last but not the least is the crown jewel of our health program, which is the Repetitive Strain Injury Program. Chevron continues to strive for occupational excellence through investing in our biggest assets, our people, which is the human energy. Our goal is that we bring back our employees to their families healthier and safe every day. As a final note, the key for a successful health program depends on two things. Leadership support. So it should be beyond lip service. Leaders should be it should be falling in line if we have health activities. In Chevron, we expect that. And second, hire people who are not only knowledgeable, but hire people who care. And with that, thank you so much for listening.